Live streaming from the World Stem Cell Summit at the West Palm Beach Convention Center. It is the 12th annual Stem Cell Summit and Regenerative Medicine Symposium. We have Joe Krieger from Boston BioLife representing us here. Thank you, Boston BioLife, for having us and hosting us. And I'm going to kick this off to Joe and Dr. Miller.
We had a great day yesterday. It was the public day, and we were able to feature some of our faculty, but really get a good grip on the clinical aspects of regenerative medicine. And we heard from patients that had remarkable treatment experiences, founders of new technologies, and very interesting and exciting. I was amazed at literally 1,000 people who showed up here today and yesterday. So we're excited for day two. Today is going to be more of a clinical forum, and our first guest is Dr. Randy Miller, who's one of the Boston BioLife faculty members. And Dr. Miller's a plastic surgeon, but he focuses on biologics derived from adipose, and he is an expert in the acquisition and the preparation, and also he's an advocate of assisting other physicians in their awareness of adipose biologics, and he has an active role in China. So we welcome Dr. Randy Miller to tell us about Miller Plastic Surgery and how he got involved in this wonderful field and what he believes that the potential is.
Okay, well, thank you, Joe. It's great to be here, and my compliments to Boston BioLife. Really helping a lot of physicians understand not just the clinical aspects, but the scientific aspects of stem cells and regenerative medicine. My journey with adipose tissue and adipose stem cells actually started in my plastic surgery residency, which I did at the Texas Medical Center in Houston. And about 25 years ago, we started to use adipose tissue for cosmetic purposes. And then as we were progressing, we realized that it was such a great filler, it was such a great material, that we could start using it for reconstructive cases.
Can you tell us a little bit, because people here understand what adipose tissue is, but some of our community doesn't understand what adipose tissue is.
Okay, I'll say adipose tissue, and it is a 3-letter word, fat.
Nice.
F-A-T. So yes,
can we take it? And you want to put it back in. I'd rather take it out. And you want to put more in.
Well, we can redistribute it. We can take it out. We can put it in the bank. We can do all kinds of things with it.
Imagine putting fat in the bank.
Yes.
Nice.
Yeah, just like cord blood, you can bank cord blood. Now you can bank your adipose tissue as well for the future of your health.
So you take it from one place and inject it back in another?
Well, you can do that. You can take it out and then process the cells in a laboratory if it's part of a clinical trial or a drug study. And then you can also take it out and put it in the bank and use it in the future for stem cells or for just adipose transfer for cosmetic purposes.
How does Boston BioLife and Dr. Miller work together with adipose tissue?
Well, Boston BioLife is an organization which has a lot of focus on musculoskeletal disorders.
Okay.
And because I have a lot of collaboration with musculoskeletal doctors in Miami, I've become kind of like one of the few people in the musculoskeletal world that really knows about adipose tissue. Historically, adipose tissue is used by plastic surgeons and has not really been used in regenerative medicine or in the treatment of musculoskeletal disorders. But now we're finding that stem cells, the highest concentration of stem cells in the body, are actually in adipose tissue. And so it's become a great donor source for point-of-care treatments with stem cells. So my involvement with Boston BioLife is to kind of be on the adipose or the fat side of things and teach the doctors how to actually harvest adipose tissue from a patient safely so that they don't have to call a plastic surgeon every time they want to do it. They're not performing liposuction. It's not a cosmetic procedure. It's more called lipoaspiration, which is taking a couple hundred cc's of fat, which has millions of stem cells, and then helping them not only obtain the tissue, but then process the tissue and prepare it for injection. I am a hand surgeon as well, so I do a lot of work with the fingers and the wrist.
Can we inject the fat in here?
Yes.
Get rid of the veins?
Yes. Hand rejuvenation actually is a procedure I described about 10 years ago in Miami, because we had something for every area of the body. We had something for the eyelids, for the face, for the nose, for the breast, for the tummy, for the legs, for the arms, but then somebody would reach across the table and you'd say, oh my gosh, I thought you were 30 and now I know that you're really 80. So I said, well, let's take that same concept and apply it to the hands. So yes, it worked very well. And not only is it act as a filler to camouflage the veins and the tendons, but also the stem cells in the adipose tissue works to get rid of the age spots. And I do a lot of this work in China, and I know that
I'm going to get you on later.
I know that ladies drive in Asia or go outside, they wear gloves because they do not want a single spot on their hands. So now we're doing a lot of hand rejuvenation in Asia as well as in the West.
So where do you pull the adipose tissue from?
We get it from anywhere we can. Typically,
there's plenty of places.
Yeah, I mean it's interesting because there's a lot of cultural differences. In Asia there's not as much body fat on patients as there is in America. It's kind of an unlimited amount of material.
In this country.
Oh yes, yeah, we have abundancy. That's right. That's right. so we'll take it from the tummy or from the love handles or the back. And a lot of it depends on what procedure we're doing. If we're doing like a knee injection for musculoskeletal disorders, we'll harvest the tissue from the tummy. That way we don't have to change the position of the patient. So they can harvest the adipose and then process it and inject it into the knee without having to re-prep and re-drape and reposition the patient.
It's just with the needle aspiration, not a trophar?
Well, actually, I've designed harvesting cannulas for a fabulous company called Tulip Medical out of San Diego, and they've been very, very nice and willing to work with me to develop harvesting cannulas that are blunt so that they don't cause any trauma to the tissue, and they're also disposable. So you use it once and you throw it away, which is really, really good for sterility purposes. So.
I'm going to run to the exhibit hall.
Okay.
So I'm going to leave you to your
in good hands
master,
here. Okay.
Plan with Dawn.
Okay.
And I will be back.
Hop in and out. We're here.
I just saw 400 people walk down to the exhibit.
Yes,
space, so
you need to be there.
Support my team.
Sure.
And I'll be
Support
back.
your team. We will
right.
support you here.
And you are in good
Keep
hands.
sending us
with,
people.
Randy Miller.
Okay, Joe.
Send us
thank
anyone
you.
you'd like us to
I will.
share the
I'll get it.
information. Joe, I think you left your phone over there on that chair,
Yeah.
My towel.
so that would be good too.
Terrible towel.
You don't want it? So you are on faculty with Boston BioLife?
Faculty with Boston BioLife. I also teach at the University of Miami and resident
Again,
education.
go Canes.
Go Canes, right, exactly. But it's been a very interesting journey because when we first started using adipose tissue, we had no idea that there were actually stem cells in fat. So we were using it for first cosmetic purposes, and then we were using it for reconstructive purposes. And when I was training at MD Anderson, we were injecting adipose tissue just to correct contour irregularities in ladies that have had mastectomies. And if they had an open wound from a previous radiation injury, these were incurable wounds that there's lots of different hyperbaric oxygen, topical treatments, nothing would get these wounds to close. And what we found was when we were injecting adipose tissue or fat tissue around the areas of the radiation injury, all of a sudden the wounds started closing. If they'd been there weeping and causing the patient great discomfort for 10, 15 years, and we didn't know how this was happening, and we didn't know that there were stem cells in adipose tissue. So then when we discovered that there were stem cells, we were like, wow, we can use these stem cells for lots of different things. So adipose tissue, fat tissue, has 1 million nucleated stem cells in a cc of adipose tissue,
Wow.
1 cc. And we compare that to bone marrow, which has been the classic donor tissue of before we came across adipose. There's only 30,000 nucleated cells in a cc of bone marrow aspiration versus 1 million. 30,000 versus 1 million. So we found that now we can take the adipose tissue, we can get rid of the fat, and we can isolate the stem cells and use it for things like Parkinson's, Alzheimer's, stroke, pulmonary fibrosis, emphysema, cardiac injections. So the adipose stem cells have been shown to be very angiogenic. They stimulate the growth of blood vessels. We've saved people from amputations by injecting stem cells into their leg.
Wow.
Even people who have failed surgery and have a black foot because of lack of circulation, we've been able to salvage many of these patients using the stem cells from fat tissue.
So I would guess from diabetic neuropathy as well, if we've got limb dysfunction and...
Absolutely. It's very, very effective for cooling off nerve pain related to diabetic neuropathy. We've had great success, just a simple injection under the skin in the office without general anesthesia, and we're curing these patients of a very uncomfortable disorder and situation.
Do you see a difference in the stem cell quality on the age of the patient?
Yes, well, there's as you get older, your cells are not as active. We did we have looked at this and we have analyzed the bone marrow stem cells. The activity drops off sharply with age. With adipose tissue, there doesn't seem to be as much of a decrease in the activity of the stem cells through time. Now, as you get into your 60s or your 70s or your 80s, and if things kind of trail off, then of course, there's probably not going to be very many good stem cells in an 80-year-old, and that's why patients are saying, let me put it in the bank when I'm 40 so that I can have it there in my private account, and then later if I need it, if God forbid I have a stroke or a heart attack, I can just get my own cells from the bank because they're there.
It's almost like donating your own blood, but you're donating your own stem cells, so you have it later, just like
Correct.
we talked about cord blood from
Correct.
the fetus.
Correct, exactly. And a lot of the adipose banking technology actually was developed by the people who pioneered cord blood banking. So they also have recognized the benefits of adipose tissue and the huge number of stem cells in the adipose tissue. And so now, we're able to bank those specimens, and we have a lot of patients who are very excited to put their cells away for the future. And the other thing is that every day, every year, we're discovering more and more applications for these stem cells. Ophthalmologic, for macular degeneration, diabetic angiopathy. So it's great to have your stem cells in the bank. You don't need to use them. And then every year you're going to learn about more and more and more cures with stem cells for different disorders. And just nice to know that you have your cells there waiting for you for all these other discoveries that are going to come down the line.
And you're on faculty at UM, so do you, over the years since we've been through the medical school process, do you now teach stem cells to your students?
Yes, and actually it's interesting because I would say 95% or greater of the physicians in practice right now know almost nothing about stem cells.
Right.
And so I have found myself lecturing to medical staffs from entire hospitals and having all these doctors come up and say that they have never heard any of this stuff before. And we joke around because I guess we're like the first 400 or 500 people that knew about the internet before the rest of the world, and we're like, wait till everybody finds out about how amazing this is. But it's not top secret information, and it's amazing to see that there are so few doctors that are really knowledgeable. The patients are actually the ones who are the driving force behind stem cell treatments and regenerative medicine therapies. The patients are coming in saying to the doctor, I want stem cells. And the doctor says, I don't know anything about stem cells. And so it's kind of our job to help train them, and that's kind of what the nice thing about Boston BioLife and all of the academic activities that we have is we teach now medical students, residents, and doctors who've been in practice for many years how, the science and the clinical aspects of stem cells and regenerative medicine.
You teach more than just the pain and management of it in joints. You're teaching it for cosmetics, for wound care. Is incredible.
Well, yeah, one of my most fun things regarding stem cells has been interspecialty collaboration. I walk into a heart surgery meeting and people look at my name badge and they say, did you get on the wrong plane?
Well,
you're a plastic surgeon.
Exactly.
Why would you be here at a vascular surgery meeting or a cardiac surgery meeting? And then at the end of my talk, everybody is lined up in the back of the room, wanting to come to my office and train and learn about these things. So I work with the dentists, the maxillofacial surgeons. We're using it now for gingival recession. There's no good treatment for receding gums. Gum grafts do not work. Palate grafts, alloderm, these things are not effective. The dentists are not happy with the outcomes of these treatments, but there's nothing else to offer the patients. Now we're taking adipose tissue. I combine it many times with what's called PRP, which is platelet-rich plasma, and then we inject it into the gum tissue, and patients are regrowing their gum tissue with that. So we're revolutionizing.
So you're pulling out your taking the blood, you're taking adipose tissue, everything's spun down and put together almost like a cocktail and re-inject it back in.
Exactly right. Exactly right. And so, working with the my musculoskeletal colleagues, I now have a whole crew of orthopedic surgeons, PM&R doctors, rehab doctors,
I'm sending my husband to your office.
Anesthesia pain doctors. Yeah, it'd be my pleasure. Absolutely. I mean, and the fun thing is that the more people we train, and the more people that do these types of the more physicians that do these types of procedures, the more we will learn from each other. And we're learning. The learning curve is still fairly significant. So we know what we did, and we know the results, and we know we're not hurting anybody. but we really don't know the middle part, which is the science behind this. How do stem cells stimulate the production of brand new tissue in your body? We don't know the answer to that. So this is why, I'm collaborating with lots of different clinicians, but also with a lot of different scientists, so that we can try to connect all the dots. Because it is a little uncomfortable for a doctor to say, well, we don't know how this works. We're getting great results, but we have absolutely no idea why or how. So we need to improve our knowledge of the actual mechanism.
Because to me, at the most basic level, you would think the stem cells are regenerating cells.
Correct. I mean, and we have tagged the cells, and we follow the cells in the body, and we can see that, for example, if we inject stem cells into the heart, only 5% of the new heart muscle that's growing contains the tag. So 95% of that tissue is being produced by what we think is called the stem cell niche in the organ itself. So every organ in your body, your skin, your bones, your heart, your lungs, they all have a stem cell niche. That's how you grew as an embryo, from one cell into a human being. So somehow introducing stem cells into an area will stimulate the growth of new tissue, and somehow the stem cells also know how to get to that area. So if we have a patient with a stroke and we give stem cells IV and we look on a scan, we can see that all the stem cells end up in the area of injury. So it's absolutely fascinating.
That's the amazing thing. Is we were talking yesterday where they inject the stem cells into the cerebrospinal fluid.
Yep.
For brain and for MS and for ALS, and the stem cells know where to go.
Yeah. They know where to go. They know how to get there. They know how to regenerate new tissue.
Amazing.
And we don't know how they do that, and we want to know how they do that.
How did you get involved with all of this?
Well, when I started working with adipose tissue 25 years ago for cosmetic purposes, and then we were using it for reconstructive purposes, and then we saw that wounds were actually closing, and things were healing, and new tissue was being generated or regenerated. And then in 2000, we were amazed by that. And then in 2001, the first publication came out identifying stem cells in adipose tissue. And then we said, aha, that's why all these patients are getting better in the areas where we're injecting the fat. It's not because of the fat, it's because of the stem cells that are in the adipose. So that led me to be very curious about, what these stem cells can do. And, the meetings like this, the World Stem Cell Summit, it's great because we have all different disciplines here. We have all different specialists from all different areas of medicine. We have scientists from all different areas of medicine, and so now we know the cells are there, and so I've started to use them for a lot of different things like eczema, psoriasis, hair restoration, lower eyelid discoloration, dark circles under the eyes.
I'm coming too.
Lots of cosmetic things, but also lots of reconstructive type things. So I think my curiosity, I got very curious and started to safely transfer these cells from one area of the body to the other, collaborate with other specialists, because I don't know how to be a neurologist, I don't know how to be an orthopedic surgeon, I don't know how to be a PM&R doctor, but they don't know how to harvest adipose tissue from the body.
Sure.
And how to process the tissue and how to combine that with PRP. So we find that working together, we're really having a lot of fun, and we're helping a lot of patients, and it's just the momentum is gaining, and it's a worldwide recognition of regenerative medicine and stem cells. It's not like just a few doctors in the US are doing this and nobody else has heard about it. We have collaborators in China, in Korea, in Japan, in the Denmark, in the Czech Republic, in Italy, and it's the same little group of us. We all know each other, but it's a global phenomenon that's happening right now, and that's also helps us believe and understand that it's real, because if it was just a few of us that were recognizing this and nobody else was seeing that, then it would be hard to really feel confident that this is actually something that's scientific and that it's a reality.
It's definitely global, the World Stem Cell Summit. I know you're speaking at 10:30.
Yes, I'm speaking at 10:30.
How can people, our listeners, other physicians find you?
Well, you can go to millerplasticsurgery.com, so we have a website. And also, I'm scared to say this, and I hope I'm not saying it the wrong way, we have a Facebook page.
Okay.
So you can like Miller Plastic Surgery, and that's a good way to kind of keep in touch with what's going on in our practice and learn about a lot of the different stem cell activities that we're involved in. So those would be the two ways. Of course, we have the old-fashioned 305-377-1700. That's also another way to just get direct access to our office.
And you're located in Coral Gables.
In Coconut Grove.
Coconut Grove.
Yeah.
South Florida. I'm so excited to continue our conversation more.
Me too.
Thank you. Come back anytime. We're here for the next 3 days.
Great.
Enjoy your talk. What are you
Thank
talking
you.
on?
Talking about the combined use of adipose stem cells and platelet-rich plasma for expanding indications, dental, dermatology, musculoskeletal, etc.
List goes on and on. Thank you so much.
You're
it was
welcome.
a pleasure.
Thank you.